Hello everyone and welcome to this channel. Today we will be talking about drugs that can be used for neurodegenerative diseases. These drugs, they affect the central nervous system by altering some step in the neurotransmission process. An example of neurodegenerative disorders that can respond to these drugs are Parkinson's disease, Alzheimer disease, multiple sclerosis, and amyotrophic lateral sclerosis. The neurotransmission in the central nervous system involves the release of different neurotransmitters that diffuse across the synaptic space to bind to specific receptors on the postsynaptic neuron. And these neurotransmitters can be classified as either excitatory neurons or inhibitory neurons, depending on the nature of action they show. The stimulation of excitatory neurons causes the release of neurotransmitter molecules such as glutamate or acetylcholine, which will cause a transient increase in the permeability of sodium ions, and this will lead to a weak depolarization. While the stimulation of inhibitory neurons causes to release neurotransmitter molecules such as GABA or glycine, which will lead to a transient increase in the permeability of potassium and chloride ions, and this will cause a weak hyperpolarization that will diminish the generation of action potential. If we start with Alzheimer's disease, the dementia of the Alzheimer type has three distinguishing features, which are the formation of numerous neurofibrillary tangles and the accumulation of senile plaques, which are beta amyloid accumulation, and also the loss of cortical neurons, especially the cholinergic neurons. It is important to know that the pharmacological intervention of the Alzheimer's disease is only palliative, and it provides a modest short-term benefit. Therapies that are available for this disease are acetylcholinesterase inhibitors and the NMDA receptor antagonist, which is a glutamate receptor type, the NMD1 antagonist. The acetylcholinesterase inhibitors are aimed to improve the cholinergic transmission in central nervous system, while the NMDA antagonists are aimed to prevent excitotoxic actions in selected brain areas. Studies have linked that the progressive loss of cholinergic neurons and possibly cholinergic transmission within the cortex to memory loss, which is a hallmark symptom of Alzheimer's disease. That's why it has been shown that inhibition of acetylcholinesterase within the CNS will improve the cholinergic transmission, at least the neurons that are still functioning. Examples of these drugs are donepezil, galantamine, rifastiglin, and tacrine. Overstimulation of glutamate receptors, particularly the NMDA type, has been shown to result in excitotoxic effects on neurons, which is the mechanism for neurodegenerative or apoptotic process. This happens through glutamate binding to the NMDA receptor, assist in the opening of calcium ions, and this excess increase in intracellular calcium can activate a number of processes that ultimately damage the neurons and lead to apoptosis. That's why NMDA receptor antagonists, especially in the one which is approved, memantine, are often neuroprotective and they prevent the loss of neurons following ischemic or other injuries. If we look at multiple sclerosis, which is an autoimmune inflammatory demyelinating disease of the central nervous system, corticosteroids have been used to treat the acute attacks of this disease. Also, chemotherapeutic agents such as cyclophosphamide and azathioprine have also been used. Interferon beta-1 alpha and interferon beta-1 B have also been approved as immune system modulator of the interferons and T-helper cell response, which contribute to the inflammatory response that lead to demyelination of the axon sheaths. Fingolimod is the first oral drug that can slow the progression of this disease because it alters the lymphocyte migration, resulting in sequestration of lymphocytes in the lymph nodes, and it is effective in reducing the relapse rate in patients with MS. Another immune modulator is mitoxantrone. Another drug that's used in MS is dalfampridine, which is potassium channel blocker, and can be administered orally to improve walking speeds in the patients. There is also monoclonal antibody natalizumab that can be indicated for patients who have failed first-line therapies. The last neurodegenerative disease will be amyotrophic lateral sclerosis, and another NMDA receptor antagonist is approved for this disease, which is riluzole. And this drug, it improves the survival time and delays the need for ventilator support in patients with ALS. Thank you for watching. Please don't forget to subscribe to this channel.